community of Delagrande is about over an hour and a half by very bumpy, very hilly, several incredibly steep hills. So really only all-terrain vehicles or jeeps can get through there. My name is Jenny Huntley, and I'm a registered midwife, and I've been volunteering with Midwives for Haiti. Many women have told me they've come from quite a far distance, an hour, even a couple hours of walking. Women seem to really be drawn to having someone just do a quick assessment of them and feel their belly and hear the baby's heartbeat and hear that everything is going well. Because of the Jeep, we're going to be able to run these mobile clinics to include places like Delagrande that we haven't been able to go to because of distance.
Well, good morning, everybody, or good afternoon, depending on where you are. Thank you so much for that introduction, Art. And I have my slight reservations about an introduction photograph of me saying having paint splashed on my face. That was the relevance of that. That was actually at a board meeting. It's at Jennifer Jones's brother's studio. For those of you who just think I slapped paint on my face, that was immediately after a board meeting. Getting some downtime, but the thing I like about it is the t-shirt we're wearing. The relevance today is that End Polio Now t-shirt, and there's no better way for us to recognize and support Maternal and Child Health Month than is to wear those t-shirts and is to continue to give to our #1 priority, End Polio, which will help so many children escape the ravages of this crippling, brutal disease forever. If you talk about lasting change, we talk about in our vision statement, End Polio really is the gold standard, and John Germ did not pay me to say that. So John, welcome, great to see you here as always. You'll be hearing more in a really great presentation on maternal and child health later in the program, as well as an update on empowering girls. And of course, good child health is a prerequisite to empower girls. So we're looking forward to that. I've just come back off travels, and yes, I was in Las Vegas last week for a brief business stop. Managed to spend most of my days on Rotary Zoom calls like this one, so blending Las Vegas with Rotary was the best way to see it, the best of both worlds in many, many ways. Just before that, I was at the Carolinas Pets 2 weeks ago, thanks to Cookie and her team for another tremendous pets event. It is so important that we take this time, this period in our Rotary calendar to prepare our president-elect. They really are the most important members of our organization right now. And good pets training is so essential. And being able to do it one-on-one and together and in the hallways, face-to-face, is something that not everyone's experienced over the past few years. And it's really been good to be back together. And with our organization challenges that we have in relation to its change in management and leadership every year, PETS preparation is absolutely essential to continue to promote the continuity that we need between our president's lines. And of course, it's especially important to keep this going between our governor lines communication. The handover there from year to year is absolutely essential to ensure that we continue to build and strengthen. Now, moving on to district conferences, we will use them to inspire, again, in the same way, and I'll be at one shortly in South Africa, where I'll be President's Rep, and then at a few in the United States virtually, and then the Caribbean. But again, let's use them to build our messaging that we need to create irresistible clubs, in the words of Rotary International President nominee Stephanie, so we can give our members absolutely maximum value by enhancing their Rotary experiences so they can deliver maximum impact with relevant service projects in our communities, which will in turn lead us to grow Rotary and share our amazing organization with even more customers. And going back to continuity, I mentioned, and I've had some meetings last week, and some of them are important ones as we prepare at board level to do exactly that. And I've been meeting with outgoing chair of the executive committee, Elizabeth Yusevich, as I prepare to take on that role next year for President Gordon. And it's exciting to see that we have made sure that we can continue to walk the walk of continuity and not just talk the talk, by making sure that transformational issues that we'll be looking at next year are based upon the ones that we've been focusing on this year as well. They include, as I mentioned to you before, a more regional approach to how we do our Rotary, creating greater inclusion by creating more comfortable and caring clubs for our members as a way to grow and strengthen our clubs, as well as to increase diversity. And external relevance through partnerships. It's an area where we continue to need to work on, whether it be in terms of partnerships with NGOs and community partners, or possibly corporate partners. And a big part of that, of course, is will be Rotary International President-elect Gordon's focus on mental health and wellness as we move forward. And one example of the regional approach is, of course, what we've been doing ourselves for the past year in our membership action plan. And now we're also focusing, as mentioned, on our foundation action plan. And I once again want to recognize past RI Director David Stovall for taking this on, along with Trustee Chair-elect Barry. And they're both guiding this process, and we intend to roll out a multi-year, the first year of a multi-year foundation action plan, July 1st this coming year. So look out for that, and we're really excited about that. And in fact, fits very, very nicely into this whole concept of a more regionally adaptive approach. Talking of trustees, we've just had confirmation that our trustee for our paired zones next year will be none other than someone who's very, very well known to us, past RI Director Larry Lunsford. Larry will be working on that foundation action plan alongside us and part of the team. So we'll have Larry and Barry and David working together on that. And as you know, Barry, of course, will be taking on the role of Trustee Chair-elect. So I think we've got a powerful team there. And I know we're determined to roll out a plan which will be something that can be potentially scaled across other zones as we show its success in ours, focusing on some of the challenges that we have and making sure that we optimize the foundation in terms of the opportunity for giving and also the opportunity to get involved in grants and deliver greater impact and lasting change to our communities. So, of course, the major finale to our year is coming shortly, and that's the up-and-coming Rotary International Convention in Melbourne. And for those of you who are planning to be with us, make sure you register for the off-campus, so to speak, event of the event. That's the Southland reception, and it would be the place to be. It's going to be on Sunday, May 28th from 5 to 7 p.m. at the Hop House Bar and Restaurant, which was the 2022 winner of the Best Function Event Space for Victoria. So it's not going to be just an opportunity for us to network between ourselves, but we have a plethora of Rotary senior leaders coming. Plethora, I think that's the right term. And of course, it starts with Rotary International President Jennifer Jones and Nick. Of course, President-elect Gordon will also be there, as will President nominee Stephanie, along with Tom, Hooray. We'll also have Rotary Foundation Trustee Chair-elect Barry with us, myself and Director-elect to-be Patrick will be there. As well as that, we'll also have the majority of the board of directors and the directors-elect there with us at that time. So we're looking forward to a great event. So if you want to register, places are limited, but you can do it through your DuckDB link. It's $75 US per person, and will be an amazing event. As Art likes to remind me, where else can you go and drink as much beer and wine as you want in 2 hours for $75 only? I'm not suggesting you do necessarily do that, but that's the spin that we put it on. In any case, let's now switch back to the topic that we're here for to talk about today. And it's my great pleasure to introduce our area focus manager for disease prevention and women and child's health. Narisi is with us today. She holds a very important role within Rotary, and I'd like to welcome her, and thanks very much indeed. And please join me in welcoming Narisi Castro Espadas. Narisi, over to you.
Thank you so much, RID Jeremy, and thank you to Zone 33 and 34 for having me. I'm happy to be here. Like Jeremy mentioned, I'm Dr. Narisi Castro Espadas, so I hold the role of Area Focus Manager for Disease Prevention and Treatment and Maternal and Child Health here at Rotary. So I've been here for about 2 years now, Time has flown by. Before joining the staff here at Rotary, I worked primarily in Latin America and the Caribbean, primarily in Belize, where my parents are from, and held roles with the Ministry of Health, supervising hospitals, clinics, and a variety of different associated healthcare related programs, and then worked with the UN as well, UNDP, managing a global fund program for HIV and AIDS and tuberculosis, and really doing a lot of civil society and advising government work and developing strategies. So I'm happy to apply that experience to my work here at Rotary and supporting Rotarians all over the world. So it's been an exciting 2 years. Today I have a brief presentation for you all that will take us through some of the global grant activity related to maternal and child health. And we'll go ahead and highlight some of our, some really great programs, and also highlight one of our biggest maternal and child health programs for Rotary that recently kicked off, which is our second Programs of Scale awardee. So I represent 2 of Rotary's 7 areas of focus. This particular grant shows us what all global grant activity has been since Rotary year 2014 up until Rotary year 2022. So if we see a spike that took place in 2020 and 2021, which was essentially those years in which our Rotary members around the world were responding to COVID-19, so supporting local communities and governments and ministries of health in their response to COVID-19. And then we see moving on into year 2022, we see a decline that it's more so consistent with the previous years of global grant implementation. Disease prevention and treatment is our largest area of focus by the amount of World Fund and global grant activity. We see maternal and child health. We've expensed about $64.2 million in maternal and child health global grant activity. And this is a breakdown by region. This covers all areas of focus in which we see the largest implementation taking place in Asia, followed by the Americas, and then India. We'll see a breakdown a few slides over of what that looks like in the maternal and child health area of focus specifically. And we'll get to that in a moment. This particular slide shows us our global grant activity for Rotary year 2022 up until I think the latest date that I had on file was March 21st. This is why, and I've had this question asked, this is why we see a little bit of a dip in the 2022 year, because we're not yet compiling what that year has been, a complete picture of 2022-2023. So far we've had about 60 global grants in maternal and child health for this Rotary year for a total of $3.4 million expensed. Overall, our goals for this particular area of focus is to improve maternal health and reduce maternal mortality for children under 5. So we have that broken down into a few different sub-objectives or subcategories that just really breaks down our complete picture of what we're looking at in maternal and child health. So that's complete with looking at newborn health, looking at the health of children over 5, women of reproductive age, pregnant women, and also looking at the healthcare system in a whole. So improving capacity of our essential medical services. This comes with trained and equipped professional healthcare workers, as well as the support of community health workers worldwide. This is a strength of Rotary, in my opinion, and by fact, the numbers show that Rotary has made quite a big investment in polio and supporting community health worker networks. And it's something that we have built upon significantly in the maternal and child health area of focus. Similarly to that video that was shown when this meeting was about to start, really focusing on the community. We know human resources for healthcare are quite grim in most of the developing world. So adding a community component really allows us to extend the capacity of those individuals. And it's something that is very near and dear to my heart, having seen great successes for community health worker programs all over the world. This is a chart similar to the one earlier that shows where our global grant activity. We see a smaller peak, but the peak nonetheless in responding to COVID-19 during the years 2019 through 2021. So I'm going to skip too much. This is a breakdown on the different categories in what Rotarians are implementing all over the world. So we look at the top three, focusing on maternal health care, medical equipment purchases, and then newborn health care has rounded up to top three. But I always like to highlight the category just below. Midwifery and healthcare worker training is right there, rounding off the top five. And it's very, very important in upskilling these individuals, providing the appropriate support, training, equipment, and supplies that are necessary to get healthcare out into the communities that need them most. This slide shows a little bit of a different picture than the one earlier on when it comes to the breakdown of maternal and child health global grants. Following the literature and the global statistics, where we see the highest maternal mortality is in sub-Saharan Africa, Southeast Asia, and closely followed by the Americas. And the trends that we see here in global grant funding closely follows the trends that we're seeing in the world. So it shows that we're implementing in all the right places and in the communities that need those resources the most. So kudos to all our Rotarians that are implementing grants in these particular communities. And a little bit back to the literature that I mentioned just now. This slide provides us with a breakdown of the causes of death, so mortality of newborns and children under 5. And I did not have time to update this with a more recent image, but the trends still hold true. We see about 5.2 million children under 5 that are dying prematurely. Some of them, and majority of them, are from causes that we can definitely prevent through community health worker programs, through the adequate provision of medicines, through community-based testing of infectious disease, and then through something that Rotarians support worldwide through vaccination is where we can prevent many of these deaths. We see significant deaths in this population due to malaria, diarrhea, and pneumonia. These are all preventable and easily treatable causes of death, yet they remain a big challenge in this population. So if anyone here is looking for ideas for the next global grant, then we have some right here on this slide, and I can share these when I'm finished. Looking at the maternal mortality, where we see highlighted, again, it follows sub-Saharan Africa, it follows Southeast Asia, and then followed closely by Latin America and the Caribbean, where we're seeing significant deaths prematurely by preventable causes in developing countries. So looking at in developing countries, about 1 in 45 women are at risk for dying of causes that are related to pregnancy, childbirth, and postpartum care, compared to 1 in 5,400 in the developed world. Of course, there are disparities, because if we're looking at in the United States, for example, there's significant disparities between maternal mortality in Indigenous women and in women of color, in which we are seeing significant disparities that are similar to those deaths in developing countries for those particular populations. And then this slide gives us a look of skilled birth attendance by countries. I know it's a little bit light here on this slide, but it shows us the percentage of births that are assisted by a skilled birth attendant. This is someone who is trained and licensed to practice medicine and deliver children in the various communities across the world. If you look closely at the developing world, we have OBGYNs, we had midwives, we have family care practitioners that are easily accessible. My obstetrician is 2 blocks from where I live here in Evanston, but where I previously worked in Belize, we had a single obstetrician and gynecologist for 2 districts of a country. So looking at about 70 to 80,000 women of reproductive age for a single obstetrician and gynecologist. So this is why mobile prenatal clinics, strengthening our community health workers' ability to link with healthcare systems, refer patients into healthcare systems. We see those as very integral programs that Rotarians can easily support community health worker networks and our ministries of health, and really maximizing the amount of service and the quality of service that are getting to the women in hard to reach locations. One of our sustainable development goals, I think, has us at reaching universal healthcare coverage by 2030. And the statistics are looking quite bleak. We would need an additional 18 million healthcare workers, primarily in developing countries, to achieve that particular coverage. So back to what I was saying, we're looking at over 55% of countries that have fewer than 40 nursing or midwifery personnel per 10,000. This is the amount of access that these women have to someone who has the capacity to monitor them throughout pregnancy and deliver their children safely. We're looking at significant disruptions in our ability to reach this major milestone by 2030. We've all lived through COVID-19 pandemic, and we know that that has caused significant backtracking on some of our improvements in communicable disease and non-communicable disease work. So these are all things that Rotarians across the world, again, can implement, can support. We can do scholarships, we can do training, capacity building training programs, we can do community health worker training programs, which are very exciting. I can highlight a few of them in my next coming slides, in which we can take a look at a few programs that have been implemented by Rotary members around the world. This particular program, and this picture is of this particular program in which Rotary members in Sri Lanka and Germany aided a hospital in Sri Lanka, their maternity hospital. So since this program has been implemented, there's been more than 150,000 children and 2.2 million women who have benefited from the services and the equipment that was provided in this particular country. So we're seeing reports and we're seeing great statistics of large numbers of people being impacted from simple medical equipment that we may take for granted in certain parts of the world, but that are typically lacking in many hospitals all over the world. A similar program here, in which has been highlighted quite a bit throughout the Rotary world, is a program that's been implemented in Mongolia and Nepal. So we have Rotarians in New Zealand that have supported a train the trainers model with the Mongolian Ministry of Health, and mortality and morbidity rates have been decreased by 65 and 55% since this program began in 2013, and it has been replicated. It started in Mongolia, has been replicated in Nepal, and this is still ongoing and has been completely and fully integrated into the Ministry of Health system within in Mongolia. This is one that has taken place in Guatemala successfully and has been replicated in Panama. So we're seeing Rotary members have collaborated with another Rotarian-led organization called Follow Rope, in which they're training our local midwives, or what we're calling our traditional midwives, in indigenous communities. So they're trained to provide some level of prenatal care in rural communities and in health centers, where they speak the local language. They're being trained in the different local languages. They're being trained to refer patients to hospital settings. We've even had a hospital in Panama that has supported this program that has now completely provided a delivery room in which these local midwives can actually support women that they've been overseeing within the hospital setting. They can support them through childbirth and through delivery. And if you can see where these are local women, they're part of the indigenous populations, they speak the language, they have access to the communities, and this program has been quite successful and has been replicated and scaled in different parts of the world. So we're very happy to see this type of work. And then next up, and I think it's a few of my last slides, talks about our program of Scale Second awardee. This program kicked off earlier this year and is being implemented in Nigeria. It's called Together for Healthy Families in Nigeria, and it has built upon a relationship within the Rotary Action Group for Reproductive, Maternal, and Child Health between District 1860 in Germany and District 9125 in Nigeria. They've been partnering for 25 years working on maternal and child health in Nigeria, and this particular program aims to reduce maternal and neonatal mortality in the 4 states in which it's being implemented by 25%, so reaching about 2.3 million people with behavioral change communication through strengthening community health networks, and continue providing clinical care from the community level through the formal healthcare system. And this was announced at convention. We have our 3rd competition for programs of scale. Our upcoming convention in Melbourne will be announcing the 3rd winner for programs of scale, which is another exciting program that will be announced once the selections are finalized. There's a lot of words on this slide, but it shows the thought process through the theory of change. It essentially shows how this program was selected, the different inputs that are going into this particular program, and what we intend to see over time. So what are the immediate outputs of those? It's training our healthcare workers, training our community healthcare workers, providing equipment and supplies to some of the different facilities, increasing awareness of those facilities that are providing prenatal care, postnatal care, sexual and reproductive health, and contraception for those who want them. So really filling a gap for the need for unmet contraception, upskilling our professional and community healthcare workers, and really supporting an effective referral system from the community level to the formal healthcare system. And then it also details what we expect to see in the interim and in the long term to contribute to the overall goal of reducing neonatal and mortality by 25% in those select areas. So Rotarians have done quite a bit of work in surveillance within Nigeria, and this particular program will show a combination of a great set of interventions that we have seen being successful independently over their few global grants that they've implemented, and we're combining those most successful interventions, and we'll hopefully put off a very successful program that we'll be monitoring over the next 3 to 4 years. So I'm very excited to have been able to visit with the Rotarians implementing this program and was there for the kickoff. So all our Nigerian Rotarians are very excited for this program, and we know that the rest of the region is paying close attention to our first 2 programs of scale, and we're excited to see the excitement around measuring our successes in these particular areas. And then finally, as I wrap up, I don't know how I'm doing on time, but as I wrap up my slides, I just wanted to demonstrate that there was a big shine on maternal and child health at our World Polio Day 2022, which was essentially the Rotary's Day with the United Nations this year took place with the World Health Organization, and the theme was World Polio Day and Beyond, a healthier future for mothers and children. So what this essentially tells me is that our main partner, like the World Health Organization, has seen the successes that Rotary members have built with polio and community health work and are really looking at us to start looking through the future. We're very, very close to the complete eradication of polio. I think we're looking at about 2026, in which we expect to have the world certified as polio free. And we have many different interventions. I see some claps and cheers in the crowd, but we have many interventions that will build upon those successes that we've learned from polio and strengthening community healthcare workers, providing vaccines, preventing those preventable causes of death in this population. So really taking a shine and looking at Rotary members that have been implementing in maternal and child health, and we're excited to see where that goes. And that concludes my presentation. I think I'll be joining one of the breakout rooms for questions afterwards, but over to you, Jeremy, and thank you.
Thank you so much, Dr. Narisi. Great to have you on and to have a fellow Caribbean, Central American person driving this forward. I'm exceptionally proud. Great job. By the way, before we go on to the next presentation, if anyone can spot the intentional error in relation to the month that we're celebrating, first one to drop it in the chat gets 1,000 foundation points from the director. Anyway, so just a quick one. Drop that in the nail. Whilst I'm introducing our next 2 guests, obviously empowering girls cannot happen without good maternal and child health. The 2 go hand in hand together, and it gives me great pleasure to introduce Past District Governor Dawn and Tina, who are our Empowering Girls ambassadors. Over to you, Tina and Dawn.
Thank you, Jeremy. You're absolutely right. Child and maternal health is the well-being of our girls starts there. So thank you. We really appreciate this opportunity to update everyone on the amazing work that is happening around the zones with regards to empowering our girls now. As we know, girls continue to face many challenges across the world, including the lack of education and lack of sanitary products. Barriers such as child marriage, pregnancy, domestic violence, and abuse prevent smart and very determined girls from staying in school. Education, 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 and supporting our girls of the world will help lift families and communities and entire countries out of poverty. We have an awesome team, starting with my sidekick and dear friend, Past District Governor Dawn Rochelle, who is the ambassador in Zone 33, along with all the other beautiful faces you see on the screen serving as deputy ambassadors. For a second year in a row, Zone 33 and 34 Empowering Girls team presented a parallel event during the recent United Nations NGO Council on the Status of Women Forum. We were thrilled to have Rotary Global Ambassadors Tandeka Tutu with the Tutu Foundation, Sebu Jilani from Pakistan, who shared projects that empower our girls to become empowered women. Together, we can empower girls to create positive and lasting change across the globe in their communities and in themselves. Empowering girls aligns with Rotary's areas of focus and the goals of our action plan, starting with increasing our impact. As people of action, we make decisions grounded on evidence. We have increased our impact through defining projects that protect, empower, and create equity for our girls. You can find out more about these programs in Rotary Showcase and our Empowering Girls Now Facebook page. Next up, expanding our reach. Empowering Girls is a great initiative and way to grow and diversify our membership and participation. They may be a member currently of Rotary or other local leaders who share a passion to serve. And we can expand Rotary's capacity for doing good when we welcome and engage people who represent a variety of experiences, cultures, and perspectives. New audiences create ways into Rotary for people to come together and share the power of Rotary. By creating these new channels into Rotary, we can increase Rotary's openness and appeal and build the awareness of our impact to empower and elevate our girls. Post-pandemic, we are poised to share Rotary with organizations that we may not have thought about in the past, but we must always remember our commitment to be diverse, equitable, and inclusive. Next, Dawn will share with us some ways we can enhance engagement and adapt, as well as what's up next for empowering our girls. Over to you, Dawn.
Thank you, Tina. Yes, absolutely. One of my favorite quotes is Margaret Mead. Never doubt that a small group of thoughtful, committed individuals can change the world. In fact, it is the only thing that ever has. And so as we continue to look at the action plan as it applies to our Empowering Girls initiative, we know that Rotary is uniquely positioned in every community to change lives. Through our engagement of government, business, advocacy and education, and philanthropy, we know that clubs around the globe, and in particular in our zones, are making an impact as they engage our Interact clubs. They increase their membership. And in fact, there is even a chartering club that now has an Empowering Girls specific focus. Next slide. And so as we look to increase our ability to adapt, we know that we must continue to advocate in the public and private sectors to support our girls. We know that clubs around our zones have been particularly active in maternal and child health initiatives, education of our girls, and I can go on and on. We know that if we look around the table, we know that we can do even more, and inviting more to join us is actually what we're all about for our communities, especially as we think about our local impact serving our globe. Next slide. One of some upcoming opportunities, and we know that we have a lot of folks that are within the governor lines that are already looking forward to next year, but we want to talk about what's happening this year as we close out our year strong. You see on the slides here some areas where you can find us. We're going to have Empowering Girls tables, or we have been asked to speak and to participate in these district and zone level events. We hope that you will continue to join us to advocate for district and club advocates. In fact, 90% of our districts within our zones have district advocates that have been assigned to their role within our within this initiative. So if you ever need to find us, you can look for us on Facebook. You can also email us at empowergirlsnow3334@gmail.com, or just reach out to Tina and I, and we'll be happy to connect you anytime with ways that you can continue to empower our girls now. Thank you so much. Back to you, Director Jeremy.
Thanks so much, Dawn and Tina, for the amazing work you're doing in that sector. So now it's a great pleasure to introduce someone who's going to be filling big shoes as she moves forward. So Susan Corder is our incoming RPIC for Zone 34. And she's going to be doing an amazing job as she carries on from Marshall. And by the way, one of the areas that she's going to be taking over is a social media relaunch for Zone 34, which Sean Paddy and his team have just totally revamped. So look out for emails on that shortly. So Susan, welcome. Great to have you on our team, and over to you. The messaging is so important, and you're going to be in charge of that. Over to you.
Great to be here, and thank you for the introduction. I have a couple of events I want to share with everyone that are coming up. These are really important events that Zones 33 and 34 Public Image team have put together to help jumpstart us into the next Rotary year. The first thing that's coming up are the boot camps. We have a Public Image boot camp on April 24th, and we've done this for the past several years, and it's been extremely successful. It's geared towards setting up a plan of action, a content calendar, learning a little bit more about what resources are on the brand center, and getting clubs and districts prepared for a successful year. In addition to that boot camp, we've also added one for membership and foundation teams. Now, these boot camps are open to any Rotarian, but they're specifically targeted towards the incoming public image chairs, presidents, club leaders, and district leaders. So please help us spread the word. These are on our Zones 33 and 34 Facebook pages as events, and we'll be pushing out additional information soon. You can register for all of these, a single one, 2 of them, or all, at elevaterotary.org. We also have the Zone Leadership Training Seminar for Zone 34 incoming governors, current governors, membership, foundation, and public image chairs, as well as team members, coming up in Jacksonville on June 24th and 25th. Please look out for more information and details on that. And Zone 33 is having a similar training for their district leaders on April 13th and 15th. So be sure to inquire about registering for those events. And again, please pass the information along to your respective teams on Public Image Foundation and membership and the Governor Corps so that they can be sure to attend and obtain some very crucial information to set them up for a successful year. Zone 33 is hosting a public image webinar on June 27th, so mark your calendar for that. And both the Zone 34 and 33 public image teams have consistent webinars on different topics, and we want to learn what you want to learn about. So please provide us feedback on any areas that would be beneficial for us to teach a webinar on this coming year. And lastly, as Director Jeremy mentioned, we have launched a new Rotary Zone 33-34 Facebook page. All the groups are still there, and we've even added some groups, so continue to interact with those groups, but make sure you're following and interacting with our new Facebook page as well. Now I'd like to turn it over to Rotary Coordinator Terry Weaver.
Thank you, Susan. Most of the news from the Rotary Coordinator team revolves around the MAP Membership Success Center. And we have a couple of new features we've introduced just in the past 2 weeks that I'd like to share with you. So in the interest of time, we'll roll a short video of those features, and then we'll have time for a couple of questions during the RC breakout session. Let's take a look at the new MAP Membership Success Center. Now, if you haven't set up access yet from DACDB, remember there's a how-to on the Zone site, rizones33-34.org, and you just search on access. The top article is Membership Success Center Access from DACDB. Click on that link, and there's a one-pager on exactly how to do that. So let's take a look. We start on the District tab in DACDB. Click on the Membership Success Center icon and the Continue to Map button. As you recall, this drops you right into your club, your district, and your zone. Let's take a look at a couple things you may not have noticed. First, scroll down the home page for a library of video guided tours. These are single topic, short and easy to follow how-tos for quickly coming up the learning curve of the site. Let's take a look at those. I'll call your attention to this one on goal setting for presidents-elect. This includes how to use the P-mail system template that directs the PE right to the goal setting page. It also includes a link for the PE on how to use the goal setting process. I'll also call your attention to this new report, Upcoming Year Goals by Club. Using that report, you can see exactly which clubs have set goals for the upcoming year, 23-24, and you can also see how aggressive those goals are. In this case, some fairly aggressive net growth goals. So those are the new highlights of the Membership Success Center. Specifically, the upcoming year goals by club and the ability to set a membership goal for 2023-24 simply by choosing that year in the drop-down. Thanks for watching. I want to be sure you caught that you can send all presidents-elect a P-mail from DACDB that's personalized to their club, their access level and drops them right into the goal setting page in the Membership Success Center. One click, no navigation, no login. And that PMail template has already been created in DACDB as a systems template. So I'd be happy to take your questions during the RC breakout. Thanks. And I'm handing off to Rich Glover. Rich is the Major Gift Advisor and Maternal and Child Health Advisor for Zone 33.
Thank you, Terry, very much. Good afternoon, everyone. My name is Rich Glover, and I'm from District 7620, Central Maryland and Washington, D.C. I'm the past district governor and past district Rotary Foundation chair. And on an added note, I'm in transition from District 7620 for retirement down to Florida to District 6960 by July. My current role is with the Rotary Foundation, where I joined a team of esteemed six other Rotarians from around the world in the areas of focus, Major Gift Initiative advisors on two specific areas of focus, and that is disease and prevention and treatment and mother and child. We also participate in a number of presentations from Rotarians and various non-Rotarian audiences on understanding the history and the mechanics of the Rotary Foundation and on partnerships for global grants in disease prevention and treatment and mother-child. My 6 colleagues are from Switzerland, the United States, Philippines, Canada, and Uganda. And thank you very much, Narisi, for your terrific presentation to these areas of focus. My current projects are, as are my other Rotarian colleagues in their countries and around the world, disease prevention and treatment. I'm currently working on a preliminary project, including the feasibility studies. And they are underway with a large health system in the Washington, D.C., Maryland, and Virginia area regarding admission work in the areas of cardiovascular disease. On the mother-child side, we are looking at preliminary thinking on opportunities to support the work of Generation Hope, which is a nonprofit focused on scholar teen parents to promote successful education outcomes, health and wellness outcomes, and breaking the cycle of early childhood trauma. And they are currently working from Washington, D.C., Maryland, Virginia, and New Orleans. So that is my introduction. And thanks again, Narisi, for giving us a great overview of what we are doing. And my contact can be gotten off at DACDB, but if you want to write it down real quick, my phone number is 301-980-4976. And back to you, Art.
So thanks, Rich, and thanks to everybody that participated and presented today. Thanks for all the great information. Before we open up the breakout rooms, I do want to let everybody know that we'll have one more ZOOMformation this year. It'll be May 1st, and then we're going to back off because it's a little busy this time of year. So you can see the other things that we've got coming up here, some of which have already been mentioned. But this recording, like all our recordings, will be posted, and you'll be able to pick up on all these dates and anything that you need. But you can see we've got a couple things coming up pretty fast here that we wanted to make sure you were aware of. So if there's something, and look, they even put something on my birthday. What's up with that? Not sure about that. But anyway, lots of things coming up. Please join us.